Hi friends, today I'm going to talk about a very common question which makes parents overwhelmed and anxious, and answer to that question is very uncertain. So the question is, how long will my child need occupational therapy? Answer to this question is, it depends. I know that all of you will definitely think it depends on what. So my dear parents, it depends on the need of your child, diagnosis of your child, severity of symptoms in your child. It depends upon the present skill level of your child. I'm specifically talking about autism spectrum disorder, attention deficit hyperactive disorder, learning disability. So it is very important for all of you to communicate with your therapist about the evaluation, about the goals and about the progress, because all these things together will definitely able to answer the question of this question to a certain extent, that what could be the duration and frequency for occupational therapy intervention to proceed further to bring about the visible improvement in your kid. An occupational therapist does the evaluation using different standardized assessments, using clinical observation, parent interview, medical records. Once all these evaluations are done, then occupational therapist could at least make a decision to fix an intervention protocol and to start the occupational therapy treatment for these kids for the next 3 to 6 months. So after 3 to 6 months of intervention protocol, whatever goals occupational therapist has set is to be evaluated or re-evaluated again, and you can even ask for the progress report after 6 months or an year of occupational therapy intervention. Parents, I can give you an example that if we talk about autism spectrum disorder, definitely it requires a longer duration of occupational therapy intervention in comparison to if we take the example of a kid who is facing difficulty in neuromotor skills or difficulty in handwriting. I hope now you understand that there is no specific answer to this question, that how long will my child requires occupational therapy, specifically with kids with autism spectrum disorder or learning disability, ADHD. Let you allow your therapist to have good time during the therapy, flow time, play time, so that more time your therapist will spend with your kid. Then over a period of time, your therapist would able to understand the needs and demand of your child. On the basis of that, he can change the protocol from time to time, and thus he is able to decide whether more therapy is required to achieve the specific goals, or less therapy is required, or no more therapy is required. Sometimes more therapy is required, or sometimes less therapy is required. All these descriptions and detail your therapist could be able to tell you, because he spends lots of time and make the goals for your child during the occupational therapy intervention. Sometimes therapist also helps you to decide whether it's the right time to discharge your child from occupational therapy intervention, or give a pause after the long duration of occupational therapy intervention, because that discharge and pause into the therapy is also good and is required by your child and by you as well, to know the further progress is happening because of the developmental age or because of occupational therapy intervention. At the end, I want to add that every child is different. Every child's present skill level is different. Severity of symptom is different. Every child shows different progress to the same intervention plan. depending on his skill, on his diagnosis, on his need and demands. So I would like to suggest to all the parents that once you start the occupational therapy intervention, try to give the pace and time to both your kid as well as to your therapist to provide you not the specific but the best answer to your question that how long will my child needs occupational therapy. Thank you so much.